Dr. Wolski, you treat pain, all kinds of pain, back pain, neck pain, sciatic pain, injury pain, name it. Fibromyalgia, how do you pronounce that thing?
Fibromyalgia.
Yeah, that one, fibromyalgia. I mean, it's painful apparently for people who have it. Is that something part of your expertise?
Yes, we treat fibromyalgia. In fact, we had a patient recently that she had fibromyalgia, which is pain in the muscles, just intense pain in the muscles, and she was just being treated with medications from other doctors. She was on actually on morphine, and the morphine was causing a lot of side effects. She was sleeping 18 hours a day, and the only time she got out of bed was basically to eat and to go to the bathroom. And she was having memory loss from the medications. Her grandkids would ask her about things. Grandma, remember this? Grandma, remember that? And she wouldn't even remember. It was 5 years of her life that she lost because of medications.
Right.
But we were able to put her on our pain management program, which is where we do a lot of counseling, psychological counseling, and a lot of physical therapy. We also put her on some medications called Lyrica, which is good for fibromyalgia, and we tapered her off of
morphine.
Just slowly tapered her off the morphine, and treated her with other medications to prevent the withdrawals. And we were just, she became more active. She was able to clean out the house for the first time. She was able to cook for her husband. Her husband was used to, for the past 5 years, he was used to cooking for himself. She was able to enjoy hobbies, and she wasn't sleeping 18 hours a day. She had because the medications weren't making her drowsy.
Right. Well, that's one of the symptoms, I guess, or one of the effects of having that illness. You get tired, exhausted, painful. You just simply can't move. And so many people tell us, so many doctors tell us that just simply, it's almost like a no-cure thing. Nobody knows where the heck it comes from. So you say you fixed it. And can you repeat for the listener past of what are the 1, 2, 3 main things you kind of did for that lady in terms of treatment?
Well, the main thing is we put her in our CARF-certified pain management program. That's the gold standard for pain management. And what that involved was, it was an intensive program. It's 20 days. It's 20 to 30 days, 8 hours a day. And it's got about 4 hours of counseling and 4 hours of physical therapy. And what the physical therapy does is gradually builds up the patient's strength. And physical therapy is one of the mainstays of treating fibromyalgia. The other thing we did was taper her narcotics just gradually so she didn't have serious withdrawal symptoms. So with the counseling, the physical therapy, and tapering the narcotics, she was able to, her quality of life and her functional abilities were tremendously improved.
Will she have to be on some type of maintenance program to keep it improving? I'm sure she's not back to a normal, fully active person. Maybe she is. Maybe I got that wrong. But definitely the improvements are, for a person like that, it's probably out of the world. But is there more to go? Just for the patients out there who have it, or who, so that they can see what might be involved in it.
Oh, well, she's on a maintenance program. We see her about every 3 months. And we also teach these folks a home exercise program. So exercise is key for treating fibromyalgia.
All right. Well,
and also, and if she has a flare-up, we can give trigger point injections into the areas of the muscles that are intensely tender.
But that's not the morphine which just kills it. That's something else which you inject, right?
Right. It's not addicting at all. It just relieves the pain.
Beautiful. And by having the pain relieved or released, the person is now able to be active again.
Exactly. She was able to do hobbies. She liked scrapbooking. She liked to cook. Her husband was really happy. She could.
Well, I'm sure she was
clean the house. She was basically an invalid, prior to our program, and we have many patients who have fibromyalgia who have benefited.
Right. Now, you said something about that lady that she couldn't remember anymore their grandchildren's, questions. Did that to a degree come back, or at least currently she keeps remembering?
Well, yes, if you're off the medications, you can remember a lot better.
Got it. So that also is better. She actually now remembers the name of the grandkids again, huh?
Exactly.
And more. Well, wonderful. Thank you very much for your candid, very informative talk here. Bye-bye, doctor.